Hello everyone interested in dental and oral health. Make your dental life more pleasant, healthier and more affordable. How? To achieve this, all you need to do is thoroughly eliminate, generally once every 24 hours, what's making you sick. The harmful bacteria on your teeth and the gingiva around every tooth. However, if you think that a short click on my video will explain everything to you, I have to disappoint you. However, if you want to, then buy and read my book, published on KPD Amazon with the German title Zahnverlust stoppen jetzt. In English, Stop Toothless Now. This is a practical guide for anyone looking to improve their oral health with simple tools and profound impact. This book spreads knowledge that empowers and uplifts worldwide. Millions suffer from preventable dental diseases, not due negligence, but because access to basic health knowledge and care is limited. With just a manual toothbrush, dental floss, and easy-to-learn technique, anyone, everywhere can take control of their oral health. No expensive tools, no clinics required. Those who protect their teeth protect their dignity. My book teaches simple technique for oral health, not with special gadgets, but with clarity and purpose. Oral health is human dignity and begins with knowledge. And knowledge begins at the mind and comes with my book. My name is Hartmut Tietz. I am a dentist with 45 years of experience treating thousands of patients both at home and abroad. Using the care method I developed, I've been free of cavities, gingivitis, parodontitis, and bad breath for 50 years now. This wonderful experience can stay with you forever. I slowly developed my tooth brushing and oral care method through self-experiments. It is based on scientific findings. The writings of Dr. Charles C. Cassidy Bass were a key guide. So, my method is the SBTM Technik. S is Sulkus, B is Basis, T is Touch, M is Move. The teeth, tooth, Sulkus-Basis touch move method. Now come the essentials that need to be hammered into your subconscious. I will repeat these in every video, Wednesdays at 7:30 p.m., so that those who don't know me yet can also be informed. So let's get started. First, forget the word brushing your teeth. With my SBTM method, the outer and inner surfaces of your teeth are thoroughly clean, so that only the chewing surfaces and the spaces between your teeth require a final cleaning. 2. Just remember to reach the base of the sulci surrounding each tooth with your toothbrush bristles. 3. You can only reach the bottom of this sulcus groove by angeling the bristles of your toothbrush against the gingiva. According to Dr. Bass, this is at an angle of 45 degrees, but you can also do it at 30, 70 or 80 degrees. You have to stay there and apply pressure towards the root of the tooth. Then move the bristles over a small area, always in contact with the bottom of the tooth margins. This requires neither jiggling, the Bass-Technik, nor a subsequent wiping motion towards the chewing surface, modified Bass-Technik. My technique is therefore much easier to use. The plaque and biofilm on teeth and gingiva that needs to be removed is loosened by touch and movement without shaking and can be spit out. 4. Proper use of dental floss is the only way to reach the surfaces between the teeth and gingival pockets deeper than 2 mm. No interdental brush can reach there. Floss clamped in a holder is easy to use with one hand and absolutely effective when perfectly applied with my SBTM technique. Floss must always be moved deeply below the sulcus margin until it hurts. Then slightly back it and send it upwards in a saw-like way, maintaining contact with the tooth root. 5. Essential. When should you brush? It doesn't matter when. Morning, noon, evening, midnight, night, whenever your tongue tells you, finally clean my house. There's so much dirt everywhere. I will help you. That will be about 48 hours after your last perfect cleaning with the teeth SBTM method. You will feel it when your tongue strokes your teeth. Everything is dull, furry, sticky, blah. You won't believe yet what a fantastic feeling it is when you've once again brought shine and glory to your tongue house. 6. Which toothpaste? Toothpaste isn't necessary to get rid of micro monsters. The 99 cause of damage to teeth, the gingiva and the periodontal ligament. The University of Amsterdam discovered and published this in 2006. If you use toothpaste, it should contain fluoride and hydroxyapatite to repair any slightly demineralized areas. 8. Be careful with excessive consumption of highly acidic drinks or foods. The pH in the oral is approximately 5.5. Lemon juice, for example, has a pH of 2 to 0 to 1 to 3, very acid. Acids deplete the teeth and the body of minerals and possibly also alkalis. This is not good for joints, bones and teeth. In sensitive living teeth, this causes, in addition to erosion, pain from cold and hot temperatures and from touch. And the acids secreted behind the lips by bacteria that are harmful to us cause, among the other things, cavities, tooth decay. 8. Are mouthwashes good? No. At least not the ones enriched with many chemical ingredients and advertised as bactericidal. These irritate, among other things, the many good bacteria in the long run, with negative consequences for the mucous membranes. However, oil pulling, for example, with organic coconut oil, is recommended. This is an Ayurvedic method for detoxifying the body. It creates a smooth feeling around the teeth, which are said to become slightly whiter and are hostile to bacteria. 9. Definitely try nasal breathing by nose, nasal breathing, to prevent dryness in the mouth, which can contribute to inflammation of the mucous membranes. And breathing with closed lips produces mineral-rich saliva, which has a remineralizing effect on the teeth. 10. For environment reasons, try to use plastic-free tools whenever possible. 11. What do you absolutely need? A manual toothbrush and dental floss. Nothing else. With these, and only with these, you can achieve top-notch cleanliness on your teeth, especially the gingival margins around them, as I have done for ages. 12. Are you a smoker? Don't worry. You won't lose your teeth with my SBTM Technik. I was a smoker myself for 50 years, and everything behind my lips is perfect, tight, healthy. Look, good, huh? Yeah. 13. Being gentle on the margins. Being gentle on the margins? No. This gingival structure is skin-like, tough, and can therefore be worked on quite vigorously. I've been doing it this way for over 50 years now. 14. Oh dear, your gums are bleeding? In my mind, this is a misleading word and should more accurately be dental tissue named. Your gums are bleeding. Oh, you are advised to be especially gentle and careful there. If you are not pregnant, not menstruating, these are hormonal reasons for swollen, bleeding gums, and you are not taking any medication that have a negative effect on the gingival tissue over a long period of time, the only possible cause is the prolonged presence of too many harmful bacteria in the area of your dental sulci. They have to be removed through touch and movement, even with pressure. Then it bleeds more heavily for a day or two, and then everything is fine again. And it will stay fine if you continue to do it once a day with Perfekte Technik. Tooth base. SBTM Technik, Sulkus-Base. You have to reach the sulcus base by every tooth around them. Necessary, absolutely necessary. 15. Do you have bad breath and have sprays for bad breath? Save your money, it doesn't work. If you have cavities, insufficient or overhanging fillings or crown edges or gingival pockets of 3 millimeters or more, you need to have them treated by your dentist. The cause is usually bacteria that live on the back of your tongue. You have to brush them away. I usually do this with a toothbrush, but there are tongue brushes that are so delicate that you can reach far back without gagging or gagging. Really, in about 10% of cases, gastrointestinal diseases or infected tonsils are the cause, which should then be treated by the appropriate doctors. 16. Nutrition, sweets. Enjoy your life with a good diet, rich in minerals, vitamins, protein and fiber. Not a problem unless we are living in a war or extreme poverty. Months without vitamin C can lead to tooth loss, scurvy. But where else does that happen? So, everyone knows by now that too much sweetness from chocolates, for example, is bad for your metabolism and it is said to be particularly harmful to your teeth. Why the damage to your teeth? Because the bacteria thrive on them, and where they are found, especially at the necks and sulci of the teeth, of the gum, of the gingiva, they pee, releasing predominantly lactic acid there and causing caries in the tooth structure and gingivitis in the gingiva. That is true, yes. But if these micro monsters are removed regularly at the right time, in the right places, ideally with the SBTM method for my plus flossing, and sweets consumption remains within limits. You don't need to worry about harmful effects on your teeth. Once more, it is not good, generally, the sweets, but if these micro monsters are removed regularly at the right time, in the right places, ideally with the SBTM method, plus flossing and sweets consumption remains within limits, you don't need to worry about harmful effects on your teeth or on the gingiva. There won't be any. As I said, enjoy your life with sweets. Don't feel guilty about it, and don't shout your children if you catch them with sweets. With your help, they know how to successfully chase away the micro monsters behind their lips once a day. 17. You should care for your gingiva and your teeth by brushing once every 24 hours. Bacteria that are not removed there with their PP or metabolic waste only have a damaging effect after 48 hours. So, if you've become an absolutely profi at removing them, professional removing them, you can always take 48 hours to remove them, like I do and like I did for many years. Maybe rub the outer surfaces of your teeth with a cloth every now and then, and where food residue is bothering you, remove it with toothpicks. I will once repeat this sentence. So, if you are becoming an absolutely professional at removing the bacteria, you can always take 48 hours. No, 48 hours. 48 hours. You do not believe it. It is. You only need. You must take them away every 48 hours to remove them, like I do. Maybe rub the outer surfaces of your teeth with a cloth every now and then, and where food residue is bothering you, remove it with a toothpicks. That's it. And then listen to your tongue. They will go away and say, they will search a clean house. There are a lot of tongue on the street, you know. Okay, that is it for today. Take care. See you next Wednesday at 7:30 p.m. Bye-bye. Your dentist, Hartmut Tietz.